So you've just heard the words heart disease, and it can feel like everything just stops. Your world kind of shrinks in that moment. And if you're someone who loves to be active, one question probably looms larger than all the others.
Is exercise, the very thing that always felt so good and so healthy, suddenly your enemy? It's a really scary thought, and it's the big question we're going to tackle head-on today. So how do we even begin to untangle that fear?
You know, this diagnosis puts you right at a crossroads. On one hand, every instinct is screaming, "Be careful, protect your heart." But on the other hand, everything we've ever learned says exercise is medicine for the heart. So which voice are you supposed to listen to?
And look, it's not just in your head. A lot of the time, the first piece of medical advice you get is pretty cautious. Slow down, maybe stop the intense workouts, forget about competitive sports for now. Now, this isn't meant to be a life sentence. It comes from a very real place of understanding the potential dangers. And we absolutely need to talk about those next. Okay, so before we even get to the good news, we have to be totally honest about the risks, because they aren't imaginary. When you have an underlying heart condition, putting your body under stress, well, it can have some serious consequences.
Let's be crystal clear about what we're talking about here. First, intense exercise can put stress on what's called unstable plaque. That's the buildup in your arteries, and that stress can cause it to rupture. Second, for some people, heavy exertion can trigger dangerous, irregular heartbeats, or arrhythmias. And then there's the most serious risk, sudden cardiac death, which, tragically, is sometimes the very first sign that anything was wrong at all.
To put some numbers to it, researchers estimate that for every 50,000 hours patients spend in a supervised cardiac rehab program, there is one major event. So yeah, the risk is statistically pretty low, but it is absolutely not zero.
So, the takeaway here is simple. These fears aren't something you can just ignore or push through. They are legitimate, and they have to be respected with a really careful, serious plan made with your doctor. Which, of course, brings us to the million-dollar question. If exercise has these potential dangers lurking, why on earth is it so often a critical part of the treatment plan for heart patients?
And this, right here, is the whole story in one picture. It's like a balance sheet. On the left, you've got those risks we just talked about. But look at the right side. The rewards are just overwhelming. We're talking about actually living longer, being able to do more, having fewer heart problems down the line, and just plain feeling better. The evidence on the reward side is just too massive to ignore. All right, let's flip the script. Let's shift from focusing on the risks to focusing on those incredible rewards, because the science is totally clear. When you do it the right way, exercise stops being a potential threat and becomes one of the most powerful medicines you can possibly take for your heart.
I mean, just let this number sink in for a second. Researchers looked at 51 different trials and found that cardiac rehab programs focused just on exercise. They reduced deaths from heart-related causes by almost a third. That's not just a small tweak, that is a huge, life-saving difference.
And it gets even better. It's not just about your heart. Those exact same programs lowered the chances of dying from any cause by 27%. That tells you that the benefits of this kind of guided exercise ripple out to your entire body, improving your overall health and longevity. But hey, it's not just about adding years to your life. It's about adding life to your years, right? For people with chronic heart failure, a good exercise program can boost what they're physically capable of doing by up to 30%. Think about what that means. That's the difference between getting winded walking up the stairs and having the energy to go play with your grandkids in the park. It's a real, tangible change in your everyday life.
Okay, so we're all on board with why this is so important. The benefits are massive. Now, for the really big question, the how. How do you actually do this safely? Because this is not about just hopping back on the treadmill and hoping for the best. It's all about moving smarter, with a plan. So here it is. This is the single most important rule, the absolute foundation for everything else we're going to talk about. Before you start any new activity, you have to be fully checked out by a cardiologist or another heart specialist. This is not a suggestion. It's step one, period. So what does that look like? Well, here's the game plan. It starts with that specialist consultation. From there, they'll do a full clinical workup, your medical history, a physical, blood tests, the whole thing. And then comes the really critical part, an exercise test. This is not a test you pass or fail. It's a way for doctors to see exactly how your heart behaves under stress, which lets them figure out the perfect, safest starting point just for you. Okay, so you've seen the specialist, you've done the tests, and you've got the green light. Awesome. Now let's get into the nitty-gritty of what a smart, safe workout actually looks like day to day.
Think of this as your new workout checklist. Every single time, you need a 5-minute warm-up and a 5-minute cool-down, non-negotiable. Start with things that are easy on the joints, like walking or stationary cycling. The name of the game is gradual progress. Don't jump into anything too intense. And a couple of pro tips: drink plenty of water and try to avoid jumping into a hot shower for at least 15 minutes after you're done. That sudden heat can make your blood vessels expand really fast, which can put an extra sudden strain on your heart.
Now, this might be the most important advice of all. Your doctor is your expert guide, but you are the world's leading expert on your own body. If you feel any warning signs, dizziness, chest pain, breathlessness that feels off, you stop right away. And some basic common sense is more important than ever. Don't exercise when you're sick, especially with a fever. And it should go without saying, but smoking is completely off the table.
Now we have to remember something really crucial here. Heart disease isn't just one thing. It's a huge umbrella term, and the right plan has to be tailored to your specific situation.
And that brings us to this key idea: an exercise prescription. It's exactly what it sounds like. Just like a doctor prescribes a specific medicine at a specific dose, they'll create an exercise plan that is tailor-made for your condition, your fitness level, and your goals. This is the absolute opposite of one-size-fits-all.
And it just drives that point home. The right approach for someone with blocked arteries is going to be different from someone with heart failure, or a pacemaker, or a heart valve issue. Each one of these conditions needs its own set of rules and precautions. And that is precisely why seeing that specialist at the very beginning is the one step you just can't skip.
So if you take just one thing away from all of this, let it be this: getting a heart disease diagnosis is not a red light telling you to stop. Think of it more like our GPS recalculating your route. The destination, a healthy, active life, is still the same. You just need to move smarter to get there, with the right team guiding you.
So, I'll leave you with this. The next step isn't about having all the answers. It's about starting a conversation. So think about it for a second. After hearing all this, what is the single most important question you're going to ask your doctor to get started on your own safe path forward?